Veterans Affairs Department is getting mixed reviews when it comes to toxic screenings required by the PACT Act. A new report from the VA Office of Inspector General raises questions about the training that clinical staff members receive prior to performing the screenings.
So the office says it is concerned that veterans could be put at risk. Mike Gooding has more.
The PACT Act expands the list of presumptive illnesses, including certain cancers, respiratory, and other afflictions that the Department of Veterans Affairs now automatically considers to be connected to military-related toxic exposures. The White House announced in May that more than 1 million PACT Act claims have now been granted since the bill was signed into law in 2022.
And we're not going to stop until every one of you has the benefits and services that you've earned.
More than 5 million veterans have received free screenings for toxic exposures from the VA under the PACT Act, a critical step to catching and treating potentially life-threatening health conditions as early as possible. But the VA Office of Inspector General has found that Veterans Health Administration leaders did not actively monitor toxic exposure screening training data to ensure that VHA clinical staff completed training prior to screening veterans. The office in a new report says the OIG is concerned that low training compliance numbers indicates many of these veterans were likely screened by clinical staff who had not completed training. The report concludes failure to ensure training at the national level increases the possibility that staff members screened veterans for toxic exposures without sufficient education and skills, putting veterans at risk of receiving inaccurate or inadequate information on toxic exposures. Mike Gooding, 13 News Now.
The OIG makes 2 recommendations. You can read the full report by heading to our website, 13newsnow.com, and clicking links in the news.